Good. Is it morning or afternoon? It's morning, isn't it? Good morning, everybody. My name's Robin Davis. I work as an advanced practitioner in Birmingham in the UK, and along with my colleague and friend here, Ferenc, we're chairing the CPR competition. I'd like you welcome to the final. We've had a fantastic set of preliminary rounds to have the three teams that are joining us on stage shortly. Before the first of the finalists comes on stage, I'd like to introduce three gentlemen who very kindly to judge this scenarios for us. Patrick van der Voort, Andy Lockie and Ian McConaughey. Would you like to come on stage, gentlemen? Hello. So, without further ado, I'd like to welcome the first team in the final of the CPR competition, a team from Austria.
Hey! Welcome, welcome. Hi.
Hello.
Hello, hello.
Hi.
Hi, hi. Big team. Who's going to be the team leader? Hi, hello, what's your name?
Bernhard Sigmund.
Bernhard. Bernhard, hi. Hello, Bernhard. I'm going to tell you the story. You have a quick minute to brief your team. If you want to check on the bet or the defib beforehand, you've got a few minutes because that might not be material you're familiar with.
Can we do calculation for our pediatric patient as well?
Yes.
As we normally do?
Yes.
Okay.
Yes. Okay.
So let's check the equipment, guys.
Yeah.
Ich nehme mir gleich das Stethoskop. Gell?
Okay, das passt.
Nur damit ihr wisst, ihr habt das Stethoskop schon, danke.
Do we need this one? Not really. Yeah.
Ja.
So tell me if you're ready.
Michi?
Okay, David, you ready? You
Das
ready?
heißt, der
No.
Spatel ist da drinnen, oder? Der Spatel ist da drinnen, den wir verwenden. Okay, passt.
Okay, guys. You good to go?
Yes.
Okay.
Team is good to go?
Should we do a roll calling before or after?
Sorry?
Should we do a roll calling before or after you tell us the patient?
I'll first tell you the story and then you can check with your team.
Okay.
Okay? So the story is the parents of Timmy just rang into your ED. They're very close by, but they were in panic a bit because their child rather suddenly went unwell and stopped reacting in a very short period, and they don't know what's really happening, but they're very, very anxious about it. The child, Timmy, is 5 years old, and apart from the sudden becoming unwell in like 15-20 minutes, it doesn't look good now.
Okay.
He isn't reacting.
Do we know how much kilograms Timmy has?
Well, let's say, to make it easy for all the groups, 20 kilos.
It is 20 kilos.
20 kilos.
Okay. So guys, a quick team update for you. Our patient's name is Timmy. He is a 5-year-old male with 20 kilograms. In a time span of 15 to 20 minutes, he went unwell, and his parents will drag him into our emergency department. Let's do a quick roll call and do the calculations together. Roll calling, David, you will manage the airway.
I manage the airway.
Michi, you will be responsible for the defib.
Yes.
Dani, you will be assigned for the parents
Yes, the parents, yeah.
and do a sample.
Okay, I do a sample.
And Sebastian, if needed, you will perform the chest compressions. Obviously, we are going to adapt if anything changes. Let's do the calculations together. Is there anything you guys want to add? David?
No.
Michi?
No.
Dani? Sebastian? Let's do the calculations together. Come over to me. So, 5 years old, 20 kilograms, tube size.
5.
About 5, yes.
5?
About 5, yes.
Yeah.
5 to 5.5. Intubation depth will be 14.5.
That's correct, yes, 14.5.
0.5. 20 kilograms, which means a tidal volume of 140 milliliters.
140, yes.
140 milliliters.
Ventilation frequency?
About
20.
20.
Yes.
About 20, okay. CPR, if we have to deliver a shock, which probably is unlikely, 4 joule per kilogram, which is 80 joule.
Yes, 80 joules.
Okay.
Adrenaline will be 200 micrograms.
200 micrograms, that equals 2 milliliters of adrenaline, 1 to 10,000.
Very good, Dani. Amiodarone, 5 milligrams per kilogram, will be 100 milligrams.
Yes.
That equals 2 milliliters of amiodarone with 150 milligrams and 3 milliliters.
Correct. Fluids, 10 to 20 would be 200 to 400.
Okay, 400 milliliters of fluid, 1 crystallites.
Okay.
Yeah, we are nearly done. Narcotics, 40 micrograms of fentanyl,
Yes.
40 mics of Fenta,
2 milligrams of midazolam,
2 milligrams of midazolam.
and 20 milligrams of rocuronium.
Yes, 20 milligrams of rocuronium.
And last but not least, our epinephrine will be 200 diluted to 10.
Yes, that means 20 mics over 4
Okay,
minutes.
okay, so 2 milliliter probably.
Yes.
Anything you want to add?
I think the parents
What
are
can I
almost
have the
there. I
pen?
see
I will
them
write the
coming,
intubation.
rushing in, the
Ich
parents.
muss nur kurz aufschreiben.
Okay, put him on the floor, please. Put him on the floor. Sebastian, check for airway, breathing, and consciousness. Dani, take
Yes.
care of the parents.
Come with me.
no
Come with
reaction.
me,
I
okay?
need
Come
to
with
go
me. I take
No
care of
reaction,
you,
very
okay?
pale.
Come with me.
Okay, so he's
We are taking
pale.
care of your son, okay?
What's about the
Can
skin
you tell me
color
what
of our
happened?
patient?
I connect the
Sinus, but
oxygen.
breath is pale.
Yes.
No
That's-
breathing.
We're doing 5 rescue breaths.
5 rescue breaths.
Okay, what
Very
happened
good,
exactly?
guys.
Where was he when that happened?
2,
We were at a friend's house with some friends.
3,
Yes.
Said he felt unwell,
Yeah.
4,
trouble breathing, and then he
5.
Check for
Okay, and
pulses.
after 15 minutes he was
I
not
am
Any
checking
responsive
signs
to
of
you?
life?
Oh, it's like you see him.
Okay.
No
Okay,
signs
signs
don't
of
worry,
life.
we take care
Start
of him, okay?
CPR.
Okay,
Yeah.
we're doing
Do you
50
want
to
to
2.
stay?
15 compressions.
They are doing chest
2
compressions. His heart
ventilations.
is not
he
beating at the
died?
moment. Okay. No, he's not died. But his heart is not beating. We are taking care of him. Do
Okay.
you want to stay with him or shall we go away?
It seems we have a technical
Okay,
problem.
so we stay
We
with
need
him.
a
You
rhythm,
want to
please.
sit down?
No,
Shall we take some chairs?
I don't want to be in the way, but can
Okay.
I go with him?
If we stay here, that's fine, okay? Okay.
Okay.
So I repeat that. You were with friends,
Yeah.
and suddenly he had difficulty breathing, and in 15 minutes it get worse and worse and worse until he is in this situation now. okay?
Guys,
Yeah.
Okay.
We are
Does he have
performing
any
a rhythm
allergies?
check.
Any allergies?
Sebastian, stop. Do we have a
He
pulse?
has trouble with eggs.
Do
He
we have
gets,
a pulse?
he's just
Sebastian,
not very good with
start.
eggs.
Okay.
No
Did he
pulse,
eat
pulseless
eggs at your
electrical
friend's house?
activity.
Well, he can eat,
Michi, I want you to
no,
apply an
no.
IV line, please.
Well, yeah, Snickers, but there's no eggs.
And Michi, stand
Okay, he had
by.
Snickers.
Yeah.
Okay.
Apply.
Any other allergies? Okay. Any
200
medication he has to
micrograms
take
of
regularly?
adrenaline as
He
well.
has the cream for his
Elevate the
eczema.
arm and flush it in
For
after.
eczema, okay. Anything
Nothing
else?
else, no.
Okay. Any past medical
Very good.
history? Does he have any diseases or illnesses?
No, he's a strong boy.
Okay, so it's first time something like
Okay,
that happens.
let's
Okay.
reevaluate.
So the last
Chest
meal was that
compressions.
Snickers about 20 minutes ago. Okay. And it
Sebastian,
happened at your friend's
good dad.
house. Okay. Okay.
Watch your
that was
recoil.
very helpful. Okay. I stay with
Frequency
you.
is very
If
good.
you have any questions, ask me.
Defib
and
is
we're
on.
doing the best to
Next
take care of
rhythm
him,
check
okay?
in 1 minute
so
40.
our colleague is
David, how's the
doing heart
ventilation
compressions
going?
to push the
Ventilation
blood
is
through the body.
working very
okay?
good.
Because at the moment
Very good.
his heart is not working. It's not working.
IV
okay?
line.
But we're doing best to help him. Okay. This
IV
other
line
colleague
is
is doing
established.
ventilations,
Mats.
so he puts oxygen inside the lungs. Okay. So we try to
Confirming.
keep him alive now.
You
but he's
applied
not dead. We're
200
doing best we
micrograms
can,
of
okay?
adrenaline.
Okay.
We give
You
medication.
flush it and you elevate the arm.
We're trying very
Good job,
hard to
Michi.
help him. Okay.
Okay.
So if you have any questions, do not hesitate to
We just don't want to be in the way. But
No, it's perfect here.
After
okay? If you
that,
stay
I
here,
want
it's
you to
perfect.
assist David
If you
with
want
the
to
airway.
leave, just tell me, okay?
What's your name?
My
Okay.
name's Daniel.
Next rhythm check in about 1 minute, guys. So, Dani,
I'm finished with ample.
okay.
Ample.
Guys, team update. Dani, ample.
So this is Timmy. He has about 20 kilograms. He has allergies to eggs. Nothing else, just eggs.
What is eggs?
Eggs. Eggs.
X.
Eggs, yeah. Medication he has to take regularly is just a cream for eczema, no past medical history, no diseases. Last oral intake was a Snickers about 20 minutes ago, so maybe there is something with X to do.
Okay, so
And everything happened when they were at a friend's house about 20 minutes ago, okay?
okay,
He get worse and worse and worse over 20 minutes.
okay.
He had difficulty breathing.
Thank you, Dani. Stand with the parents,
I
please.
stay with them, yes?
Guys, Michi, I want you to take over for Sebastian for the after the next rhythm check, please, which will be in 10 seconds. Okay, guys.
Everything
Yes.
all right?
Rhythm check.
Okay, I
Sebastian,
see. It's a very difficult
stop.
situation. I
Do we have
understand that.
a pulse?
It's totally okay to worry.
Do we have
Okay.
a pulse?
Sebastian, start. Was there a pulse while we checked?
No signs
No
of life.
pulse.
No.
Okay.
13, 14,
So
15,
reversible causes. Sebastian,
If you want to
I
sit
need
down, I
you
get some
right
chairs,
now,
okay?
actually.
Sebastian,
Yeah? Okay,
Um,
perfect.
please
fertig
undress the
bist,
patient.
bitte weiter vorbereiten, ein Fünfer-Tubus nehmen.
Okay. David, do you need Sebastian?
So
Sorry?
you can
Do you
sit
need
down.
him right now?
If you want, if that we intubate him, I need him, yes?
Then intubate him.
Okay.
If I'm inspecting the patient, do I
If you
see
want to
any?
leave, just
Okay,
tell me.
5.0.
No rushes, no hives, no
Yeah,
petechias.
we got
No bleed.
They examine him
Number
now.
2.
Okay,
There's
does he
a
look
cause
severely
why he
dehydrated?
collapsed, Okay.
Not
please get him on
visually.
trial.
Do something
No.
wrong.
No,
Not
you did
visually.
perfectly well,
Okay.
Get
It was the best thing to bring him instantly to
So
the emergency
reversible
department.
causes. Hypoxia, the airway is being fixed and airway is fine. We're applying 100% of oxygen.
Now they insert a tube into his trachea
And the
to
patient
bring
will be
oxygen in his
intubated.
lungs, okay?
Hypovolemia,
So we can help him
our
with
working
ventilation.
diagnosis right
He has
now
not
is
to
an
breathe from his
anaphylactic
lungs right
reaction,
now,
although we
okay?
don't see any signs and symptoms right now. Remove the cause. Sebastian, when you check the airway, were there still eggs inside? Okay, okay. Dani, can we?
Yeah.
I need some volume now, but everyone is.
Okay, bitte
Okay.
durch. Einmal noch
Working.
ventilieren.
Shall I try to get away?
Okay, the suction unit
Yeah.
is running.
Yeah, go away. I'll stay with the parents.
Okay, just
I
stay here
don't
and if
see
you need
anything
me,
on
just
the
call me,
airway.
okay? So I'm free and available to
Yeah,
get some volume.
let's
okay?
get some volume in, please.
Intubated under side of the vocal cords.
Hello, my name is Bernhard. We are taking care of your child right now. Please
Okay,
stay
can you block
seated. We
the
need
tube,
everyone.
please?
We need every man. Stay seated. I'll be here for you
Okay.
shortly. If you have any
We are
questions,
ready
feel
for
free
the
to ask.
ventilation check.
Okay,
Bernhard,
so
was
next
kannst du, wenn
rhythm
die
check commencing.
Ja. Bernhard, we are ready for ventilation check.
Let's do the rhythm check first, please, because our time is kind of bad at the moment. So, Sebastian, you take
Okay.
over for Michi. I'll be right here for you.
What says the ETCU2?
So, guys, rhythm check. Michi, stop. Do we have a
12.
pulse? Okay, Sebastian, start.
What says the ETCU2?
12.
12, thank you.
Okay.
I've attached
Okay,
some warm
when we
fluids,
have-
warm crystallites,
We
and
have
we
to do
start
a
with a bolus
ventilation
of
check.
400 milliliters. Is that correct?
This is absolutely
Okay,
correct.
so
We
I give
need
now
adrenaline again as
400
well.
milliliters of warm crystallite infusion
Yes,
and
Okay, du ventilierst da nicht.
200 micrograms.
200 micrograms of adrenaline. That means 2 milliliters of adrenaline, 1 to 10,000.
Okay, wir
Perfect,
machen-
Dani.
Okay.
Please apply it and please apply the volume.
Bernhard?
Then get back to the ventilation check. Yeah, I get you. Sebastian, stop.
Adrenaline is applied.
Are both
Sebastian,
lungs
start.
So I'm back for you.
So,
We're giving
What's
him
the
fluids
hypoxia,
now. Okay.
hypovolemia,
Fluids.
hypothermia.
He gets medications. We
What
do all
did
the
I
all we
hear
can.
on the ventilation check?
Do you have any
What did I
questions?
hear on the ventilation check?
We don't know yet. Maybe
Michi,
it's from
can
his
you do-
allergy.
he
It's
can do
okay.
it on his
Maybe
own, I
it is
think. We need
his
to do other
allergy,
stuff right
that
now.
There
Is
is
that
something
fine?
with the eggs and the Snickers.
He can do the fixation. Yeah, he can do it on his own. That's fine. Do a temperature, please.
Temperature, yes.
And add it with a blood work. Electrolytes and blood glucose.
Temperature, electrolytes, and blood glucose.
Okay.
Yes.
So electrolytes, no signs or symptoms for that, but we are going to perform a blood
Temperature
work
is
right now.
36.4.
36.4 glucose levels in the
So
blood.
temperature
They
is
do
normal.
different measurements
185.
now. They measure his blood glucose. They measure the temperature, just to check that everything is all right with
It's
that.
coming.
Okay.
It's
So
coming, yeah.
tamponade, no signs or symptoms for that. Dani, was there any history of trauma?
No history of trauma. He was at a friend's house, and during 15 to 20 minutes, he got worse and worse and worse. After eating the Snickers, he had difficulty breathing.
Okay, okay, very well.
Bernhard, I have the glucose and the temperature.
Yes.
36.5 degrees Celsius.
Yeah.
And the glucose
Okay.
levels are 185.
You see what happens now?
Okay.
You understand?
Is in the
Okay.
making.
Thank you. Stand by. No? As David is done. Stand by. Intoxications, no signs or symptoms for that. No adjustment in intra-arrest therapy.
Well,
Airway is safe.
every 2 minutes
Temperature
we
is
check the
fine.
situation,
Electrolytes are
and
fine.
it will be in approximately 1 minute. We do
Dani?
it again, and then we can tell you if he gets better. Yes.
Intoxication.
Nothing.
Okay. Tension, pneumothorax. David, airway is maintained.
Airway is secured. Both lungs are equally ventilated. We got 14.5 centimeters on the tube. ATCO2 is still 12.
Okay. Thromboembolic, it's a young patient, yeah, no history of chest pain or dyspnea, pulmonary artery embolism, no signs or symptoms for that, no adjustment in intra-arrest therapy right now. Team update, our working diagnosis is anaphylactic reaction. The treatment has been commenced with volume and adrenaline. Next rhythm check will be in 5 seconds. You are going to take
in 5 seconds,
over.
we are re-evaluating him. We're checking for pulses and see if his heart starts
Rhythm
beating.
check, Sebastian, stop.
Do we have a pulse?
You have the impression of not a strong pulse, but definitely you feel
Okay,
something there.
okay. So, frequency is about 70 and we have a pulse. Team update,
Okay.
guys, we are in
His
ROSC
heart
right now.
started beating again,
Listen
so
up,
his
David,
heart
I need your
started beating on his
attention.
own.
Yeah.
He
David,
does not
I need your
support from
attention.
us now,
You are
okay?
going to maintain
So
the
that's a little
airway.
bit
That's your role
approach
for now.
to
Michi,
better
full-on
situation.
monitoring, including a 12-lead ECG. Sebastian, you are going to prepare the narcotics.
So is he getting better?
It will be
At the
40
moment, it's a
micrograms
step
of
forward,
fentanyl,
yes. It's
2
getting better than
milligrams of
before.
midazolam,
He's in a
20
critical
milligrams of
situation, but it's
rocuronium.
getting better. His heart is beating on his own.
Yes?
And that's an
Fentanyl, 2 milligrams midazolam, 20 milligrams.
we cannot say
Okay.
in what
And
direction
first of all, let's give him another fluid bolus, yeah? 20 mil per kilo. We start with that, go for the narcotics after. That's more important right now. So you're going to apply.
400 milliliters of fluid.
Perfect, yeah? Okay, let's reassess the patient. David, update for the airway. The airway is secured.
It's still on 40.5
94.
centimeters.
Yes.
ETCO2 is
It's now 61.
61.
So we're
SPO2
now
is
re-evaluating him with
94.
The airway. Everything
94.
Is fine, okay? The airway is
Ventilation
secured.
is
We are
good.
ventilating him.
Yeah, very nice, David. B, respiratory rate. With what frequency are you ventilating?
20
There are a
per
lot of
minute.
cables now
Okay,
attached to him
our
so that we can
saturation
have a
is
look
not
at the
shown
heart,
here.
then we
Why is
can
that?
Look at the blood pressure and
Okay,
assess him.
Blood pressure currently.
work of
85
breathing.
on 50.
David, is the patient doing any breathing on his own or are you fully?
No, I'm fully ventilating the patient.
95 to 50.
He's not waking up because there
Okay.
was for some time
After the
no flow of blood
ECG,
to
I
his
want you
brain,
to assist
and
me
that
with
makes
the
situation.
re-evaluation. So we are
Okay?
at B.
That doesn't
I'm
mean
missing
that he
one B.
won't wake up in the next time, but at the moment
got
it's
the
not that he
rates.
doesn't
Yes,
realize what happened.
Yes.
Okay? And he will get some
tidal
analgesics
volume.
and some narcotics from us
Obviously, don't
to make
overventilate the
to
child.
make him relaxed.
This is slowly rising. Very good.
12-lead ECG is in place.
Okay. Can, medication is prepared. Apply the volume, please. Could you auscultate the child, please?
I will auscultate the child.
Yeah, heart and lung. Let's move to C. Are you free? The volume is applied. Sebastian, I want you to check for the pulses,
Okay,
please.
I ventilate.
What's the pulse
I
frequency?
ventilate. I ventilate. I ventilate.
Can you palpate the pulse correctly?
So his heart is beating,
What's about the
continuous
pulse
beating.
volume?
Do I hear any
So-
pathological signs?
Hey,
No.
stay with me. Okay.
Bernhard, did you call for expert help?
We call for expert help right now. We are calling an intensivist, obviously. Let's continue with the Cs. So I'm calling for an intensivist. Let's continue with the Cs preload. Like Dani, could you check for? Sorry, could you check for crepitations? Can you check the liver? And can you check the jugular veins and give me an update according to it?
So they continue examining him now. Okay, they
No
have a look and what his heart is doing.
Okay.
Jugular veins is difficult, but you do feel a liver. And there might be some crepitations, but that's rather difficult to be
I'm
sure
missing
of.
some P's. Okay.
I'm not quite sure, but I think there are crepitations over the liver.
You think there are crepitations over the
In
liver?
3 seconds.
What's about perfusion back to the head? Like the patient is still okay. Okay. Let's go to the next point. Let's go to D. David or Sebastian, check the pupils, please.
Before the perfusion, the capillary refill time is about 3 seconds.
Cap refill, 3 seconds. Very good.
Pulse volume is
It's
It's, yeah, you can palpate peripheral pulse. It's not very strong, but it's there.
Okay.
Yeah. The pupils are mid-standing and fixed for the moment.
Okay, let's go to D. I want you to do a blood glucose, please. AVPU, the patient is unresponsive with a GCS of 3 still. Yeah. Go for hydrocortisone, go for phenystill, please.
They already asked.
Still the same.
Still the same.
For the hydrocortisone.
The ICU team is now arriving and will take over. You've already called them. Thank you very much.
Okay.
Okay. So now specialists take over. Can we help you?
Then I would ask Andy on stage to have immediately the debrief with the team while we settle up for the next team.
Can I just ask if the Czech team are here, can you progress to the preparatory area at the back of the stage? So, Team Austria. Bernard, as team leader, that felt to me to be a very comfortable team working environment with an excellent team. What was your impression of how things went?
First of all, you need to take a deep breath.
Okay. At what rate? No.
Okay. Yeah, it is kind of comfortable to work with these guys, and we practiced the closed loop communication for quite a bit, because this situation was a very good example. It's very stressful because you have the parents at the scene, and I think no matter how tough you pretend to be, it's getting under your skin and adrenaline starts pumping, and the more important it is to have good communication with your team, and they helped me out quite a bit, and yeah, thank you guys. So communication-wise, I think, and team play-wise, it went really well.
So, and it's really interesting to see your body language now is a little bit different from during the scenario. You're now relaxing, but there was definitely good leadership. So the team, how did you feel about Bernhard's leadership?
Well, I mean, there were clear roles. Everybody of the team knew what to do. We had clear commanders, so Bernhard told us what to do, and he wanted to give back information if we're finished with something, or if we have anything else to add. Yeah.
And you clearly felt comfortable about being able to feed back to Bernhard if there was anything that he was missing. Excellent. And so the parents, that was clearly going to be a little bit of a distraction. So what was your strategy with the parents?
Our strategy was that we assign one person to the parents, let the parents decide if they want to stay at the child or if they want to leave the room, and ideally make them sit down so that they do not collapse, and then we have more than one patient, and if possible calm them down and properly explain them what's happening. And obviously Dani did a good sample as well. Yeah.
So which bit of that scenario was the biggest stress for you?
It's definitely the beginning, when the parents came in carrying their very sick child and handing over the responsibility for the child to us.
Okay. And which bit do you think was your best achievement?
Come again, please.
Which was the best bit of that? Which was the best achievement in the scenario?
Team leading wise, or being able to listen to my team still, what they told me when something was happening.
Okay, and in reality, what would you now be doing? After the child has gone, what would be your actions in reality now?
Take a deep breath together with my team, tell my team to take a deep breath, and reassess the whole scenario together with my team, and which, if any of the team members especially, I mean, it's a pediatric emergency, I would give them the possibility to talk with me under 4 eyes, and I will talk with each of my team members.
And I think you should go and do that now.
Okay.
Well done.
Thank you.
Right then, ladies and gentlemen, it gives me great pleasure to welcome the next team on stage from the Czech Republic.
Hi, hello.
Hi.
Hello, I'm Patrick. Hi. Well, no problem. Who is the team leader?
I am team leader.
What's your name?
My name is Jana.
Jana, welcome Jana. Same as with the other teams, and you know the drill already. Going to give you a short scenario, and then once you're ready, if you've briefed your team, if you want to do a bit of calculations, the scenario will start. I'll give you 2 minutes to check on materials if not already done, because there might be that the bed is not familiar to you or the defib, so maybe you get now 2 minutes to just check this before we start.
Okay.
Okay?
Okay.
You can do it now.
Tu postel si zkuste. Okay.
Yeah.
It's easy. It's easy. Naš CPR. Jo?
Oni to dítě přinesou. Budeš ho chtít dát na postel?
No.
Hele, vybavení. To je naše. Deska, IV, lubricant, stříkačka, ale tam je veliká, jo?
Zapni si to.
Jo, takhle, jo?
Okay.
Introducer.
Are you ready, guys?
Takhle, jo? Tady.
Michal, are you ready?
Not yet.
Not yet. Hele, pozor, jo? Takže. Okay.
I can already brief you about the story, and then you can brief your team and do roll. What's going to happen is, and parents have called to your ED, they're living nearby, so they're coming themselves with their 5-year-old Timmy.
5-year-old, okay.
He's 20 kilos, I can tell you that.
20 kilos?
He's 5-year-old, and he actually, in a period of like half an hour, 20 minutes, half an hour, suddenly deteriorated, became unwell, became unresponsive, and they're very, very anxious, and it's just, you don't have much more than this. He looks very pale, he's not reacting, and it was in like 20, 30 minutes that things went wrong.
Okay.
And they will come in themselves.
Okay, 5-year-old child, Denny. Denny, 20 kilos, and Denny, the parents brought the Denny out to our emergency department, and Denny looks unwell, unconscious. The history is about half an hour.
Yes, quite suddenly.
Quite suddenly, okay, quite suddenly of deteriorating. Okay. So can we make a little briefing?
Yeah, you can brief your team and plan roles.
So guys, so Michal, please care about the ventilation, about the airway. Please care about the parents, because we expected the parents. So care about the parents. Please care about the monitor or safe defibrillation, compressions if we need it, and we will change every 2 minutes. So if you have any problem, please tell me. Yeah, okay. So counting. 20 kilos. 80 joules.
5 or 5.5.
5.5, okay. Fluid.
200 milliliters.
200 milliliters. 100.
0.2.
0.2.
And
40. Okay. So
I hear the parents already in the hallway. If you're ready.
Yes, we are ready.
We can let the parents in on stage.
So hello, please, look at this. Okay. What's happened?
What's going on?
Sorry.
Yes. Okay. Please, go to the Pavel and tell him everything. So, can you hear me? Can you hear me? No reaction. Can I feel some breathing? Can I see the chest?
You don't see anything
Any
rising.
pulse?
There's
no pulse. So guys, we have cardiac arrest now.
Okay.
So the Michal, please, 5 rescue breaths. Chest is rising.
Chest is rising with the ventilations. Yes.
CPR mode.
Okay, CPR mode. Thank you very much.
5 breaths.
5 breaths. Any signs of life? Any pulse? No. So we will start compression. Start with compression. Put self-adhesive pads into the child. So this is adult only. So put it in the front and in the back, to the child. And the boys 2 to 15.
Okay.
So anterior posterior.
Anterior posterior, anterior posterior. So Michal, please follow the time.
Okay.
Yeah.
I need the child on back.
Yeah.
Turn it.
Yeah, it's
So
ready.
the
Rhythm check now.
analysis.
Vitals are ready.
Stop compressions.
So we didn't see anything. Start compressions, we have problem in monitor.
Like eggs. He gets a bit of a rash
Okay,
with eggs,
2
but
to
that's not
15,
big
2 to
enough.
15.
Rhythm check now.
No, it's
So
just when he
stop
eats eggs, he
compression.
gets a bit of a rash.
So we can see the some organizing rhythm. So can I feel the
With
pulse?
eggs, we don't
No
give
signs
eggs.
of life.
No signs of life. So continue with compression.
Okay.
Please insert IO access into distal femur. And after insertion,
eggs.
please don't forget the flash, about 5 milliliters. How is the time to analysis?
For the eczema,
1 minute and 40 seconds.
1 minute, okay.
for the rash,
More than
the
1 minute.
eczema,
I have the
Okay.
infusion.
yeah, he still gets it, but oh jeez.
Maybe. Proximal tibia is also okay.
So I have the needle.
Maybe do it.
IO needle goes in.
Okay, it's in. So please give the patient 0.2 milligrams of adrenaline, yeah? Because there was PA on the monitor.
1 minute.
Has he died?
1 minute only?
1 minute.
Has he
1
died?
minute.
Has he died? Is he dead?
So now I give
Okay,
0.2
yeah,
of
yeah,
adrenaline.
yeah. And please, maybe, so give the patients bolus of fluid, 10 milliliters per kilo. It does mean 100 milliliters.
Yeah.
Okay.
Allergy?
So the compliance is okay, Michal?
Yep.
So the ventilation is
Ventilation's
okay?
easy.
If he
Compression is
eats
also
eggs,
okay,
he
okay.
eats
Yeah,
eggs,
okay.
yeah,
Is this
he
time
gets
for
like
analysis
a
now?
rash. We don't give him
30
eggs.
seconds.
Jane, I give the fluids now.
Yes, fluids is in. So
He
maybe
came
you
to
can
us, he
prepare
was
for
just-
intubation,
yeah,
but
he-
we will
he was
now we
eating
will
some
be
stuff with his friends. He was eating
analysis.
chocolate with
Then we
his friends.
then,
Time,
okay?
time.
No, stop. Is it time now?
10 seconds.
It's just we came straight
5,
here. We don't know. Is
4,
it right? Were
3,
we right?
2, 1. Stop
Analyzing.
compression. What can we see? This is the same. Can I feel the pulse?
No, and no signs of life.
No signs
either.
of life. So continue with compressions.
Can we with him?
Please prepare intubation for Michael.
8, 9, 10.
So the tube will be 5
we
cuffed,
don't want to be in the
5,
way, we
but a
stay
low
here.
pressure balloon, please.
Chest rising.
Okay. Okay.
And maybe use the introducer, it will be better. So do you know something?
1, 2, 3, 4, 5. Chest rising. Chest rising.
No, he has no X. When he was small, he has allergy on X.
10.
But
On
he have
X, yeah.
Five.
And did he eat this?
Chest
No, no,
rising.
No.
now he just came.
Dobře, bez zavadiče.
30 minutes, and he was short of breath.
Are you ready?
10.
Short of
After
breath.
breath.
But he came to parents.
5.
In the morning, everything was okay.
Chest rising.
And he has
Chest rising.
but
Rash?
Here we go.
it's a long time.
A long time problem. So maybe this is an atopic child, maybe there are some allergy. I
You're
think
in?
about it. So, yes, with
Hold it.
breathing. Okay, yes, thank you.
1 minute. Stop compressions.
It's
Is it equal?
symmetrical, yes.
Is it equal? And this is vesicular?
Yeah.
Normal sounds.
Normal
sounds on the both sides. Okay,
Bit of
fix it,
crepitation.
please.
I start
and
continue chest compression.
Yes, you will start to
He got sick
continue
and we brought him in.
compressions.
Did we do the right thing?
CO2.
Yes, and
There is
insert the
in the-
ETCO2. That's a good idea.
You get an untitled CO2
20
of
seconds.
12.
Which one?
12.
12
Snickers
only.
bars. No, I
Okay.
get Snickers. It's just a Snickers bar.
So, and Michal, please ventilate the patient. Also the continual ventilation.
10 seconds.
And 10 per minute, yeah?
Okay.
And 15 liters, it's essential. Okay.
5 seconds.
Any small toys in the room? Just a Snickers bar.
Stop compressions, analyzing.
Stop compressions, analyzing.
Football?
I still see organizing rhythm. Any pulse?
No signs of life.
No signs of life. Zdenek, continue with compression, please. I think it's a time for adrenaline again. So 0.2
we've been with him all morning. He's done nothing bad. He's
0.2
done nothing
milligram.
bad.
So he played football with his friends.
Yeah.
So I give 0.2
Okay,
of
so
adrenaline now.
I think it's time to exclude the potential reversible causes. So the hypoxia we ventilate with 100% of oxygen. Any important information?
He played play football with his friends.
Okay.
Before it starts, but no injury.
No injury.
Didn't know
And,
and he ate Snickers bar.
Snickers ball, yes, it's maybe allergy. So please undress the child. Can I see anything interesting?
Sorry, parents.
You don't see anything specific when undressing.
Not specific.
Out
Okay.
the baby, yeah.
Okay. But I suppose that there is maybe hypovolemia also due to, so the hypoxia is okay, hypovolemia, so give the patients another bolus of fluid, so 100 milliliters of balanced crystalloids. Yeah?
So 50 seconds.
50 seconds, okay.
Now is given.
Yes. Hypoxia, hypovolema, metabolic disorder, please blood samples, maybe electrolytes, hypothermia, and check please the temperature of the patient.
So I give the sample and I send it.
Tension pneumothoracy,
30 seconds.
30 seconds, the sounds was equal.
As long as we're not in the way.
Yes, the sounds was equal. Tamponate, I don't suppose. Thromboemboli.
We will if we do.
It's a small child temperature.
Temperature 36.4.
36.4. And toxins maybe because I suppose maybe some allergy if there was a Snickers.
10 seconds.
Okay.
Did we do this?
Okay, 10 seconds.
Did we do this?
5, 4, 3, 2, 1. Analyzing now.
Stop compression, please, the neck. I see organized rhythm. Is there any pulse?
I think you feel, be it weak, but you clearly feel a pulse now.
I feel the pulse now.
Yeah, definitely.
So, okay, we have an ETCO is now. ETCO?
ETCO has gone up to 56.
56, okay. So we have ROSC now, guys. That's good. But now we will start with initial assessment. So A is secured. Okay, A is secured. B.
I give the blanket.
Yes,
now.
Please give the blanket. And
20. No.
Yes, please ventilate. So, please, the first, is there any spontaneous activity? Is there any spontaneous?
Breathing.
So please ventilate the patient and ventilate 20 per minute according to ETCO to 7 milliliters per kilo. So okay, work of tidal work volume is soft and work of breathing is okay. So the chest is equal.
Comes up and child isn't doing
any
anything
retraction,
themselves.
no retraction.
No,
so
no,
okay,
nothing themselves.
Can I hear anything interesting or it's equal? And
There's a little bit of crepitations, but not that much specific.
A little bit crepitation. Yes, SpO2 is now
94.
94. So we will continue with 100% of oxygen. So this is a B. Any injury after?
No injury.
No injury.
Seen.
Okay. So we will continue with C. So is there any pulse peripheral?
There's peripheral pulse. It's a bit weaker than central, but
okay,
there is.
weaker than central. Okay. It's wet or dry periphery?
Hold his hands.
Dry.
Dry, okay. Capillary refill time?
3 seconds.
3 seconds, okay. And jugular veins, flat or distended?
Difficult to see.
Difficult to see.
Not clearly.
And
right.
the liver?
There's an enlarged liver. 2-3 centimeters a bit.
2-3 centimeters. So, okay. Please, blood pressure. Blood pressure is?
It comes up as 85 on 50.
85 to 50. Okay. It's a 5 years old. It's a borderline. Okay. So ECG to, yes, it may be. So we will continue with D.
Sorry, Jane, but in C, the treatment of maybe allergic?
Yes, please. That's a very good idea. So I think still about it. Corticoids, please. Corticoids, dexamethasone, 4 milligrams, please, and dithiaden, half ampulla. Yeah. So according to Brasselow tape. And so we will continue with D. So any reaction?
No reaction.
No reaction. Pupils?
Mid-standing and fixed.
Fixed, okay. And reaction to light?
Well, fixed, not reacting
fixed, okay,
to light
not
and
reacting.
mid-standing.
I give the treatment now.
Yes, please. Yeah. Any response to?
No response to pain.
Okay,
moment,
no response to pain. So guys, think now. So I think about the allergy. So we give adrenaline during the resuscitation. We give corticoids. We give dithiaden. So anything else, and we give the patients bolus 20 milliliters per kilo together. So the liver are larger, so maybe I think that the fluids are enough. Yeah. So do you have any idea what to do?
Blanket is here.
Blanket is here. So temperature, please, and glycemia. Yeah.
Glycemia will be 185.
185.
In millimoles.
So 185 in millimoles. 1,
Or?
No, in milligram percentage. It's 12, I think, in millimoles then? Yeah.
12.
Yeah.
12. Okay. 12. Thank you. Okay. So we have blanket, yeah?
And,
okay. Temperature, please.
Sorry, temperature. And the treatment.
Anything else you want to do before?
He is intubated, so some.
Now you're here.
Some anesthesia or something.
Okay. There is any reaction? Any reaction for the DT is Glasgow coma 3.
Yeah, yeah.
So we needn't any sedation.
Okay.
So temperature, please. Temperature.
It was already asked. Is there anybody you want to call?
Yeah, sorry, the temperature.
36.4.
Yeah, it's the same, okay? It's the same. So we will continue with TTM, target temperature management. So, and I think that now, so do you have any idea?
No.
Okay, I think that...
Thank you very much here. There's teams coming to take over from you. Thank you very much. Krásně.
Dobré to bylo.
Please stay here for the debrief with...
Okay. Hello.
Hello.
Now, we will give you 30 seconds to breathe.
Thank you.
So, team leader, that seemed like a very organized team approach. Were you happy with how your team performed here today?
Yes, I am happy because I have good guys.
So tell me about your preparations. What was the role of each of your team members, and how did it all come together?
So we work on the 3 working places in Czech Republic. So we usually don't work together, but we decided what to do because we usually prefer what to do because everybody usually specialized on some skills. So we decided against the skills and experiences and so on.
And we have ALS course.
And we have ALS courses.
Excellent, excellent. And of course, in this scenario, we had this slight additional stress that we had the parents present as well.
Yes, so that's true.
How did you cope with that?
Yes, that's true. In real life, it's a very stressed situation. That's true. So we decided to lost one member or missed one member to communicate with parent because there was many important information to take from
and
them.
it was Pavel. You were looking after the parents. So how did you manage that situation?
Firstly, I just asked them if they want to stay or they want to go somewhere else. So I just try to keep calm with the parents, and I have to ask them for what happened before and for diseases, spills. Just try to find out some important informations.
And it was a lovely image towards the end of the scenario because the parents were there by the side next to their child. So you obviously did a very good job in reassuring them through that. So how did the rest of the team feel? What was the biggest challenge in that scenario?
It's a child. That's the challenge.
Yeah, the fact that it was a child. And I noticed that you had some calculations. Was that your job to make the calculations at the beginning?
Yeah, at the beginning.
Yep. Excellent. So it was a challenge that it was a child, but what was the best thing about that scenario?
The anaphylactic reaction.
So you mean the diagnosis?
Mm-hmm.
I think the anaphylaxis. Anaphylaxis maybe on some nuts in a Snickers stick.
And I noticed that your colleague was, towards the end, was reminding you of the correct thing to do. And as an excellent team leader, you listened to your colleague, you acknowledged him, and you acted upon that. So that was
Thank
that
you,
was some
and
good
we are a
teamwork.
team, so.
So, what would you normally be doing right now at the end of a resuscitation? How would you behave now? What would you be doing?
So, after this, maybe we make some short debriefing, because this is a very stressful situation. So I think it's very important for the other members of team. So after we send the child maybe to intensive care unit, so we will make a short debriefing. What was well, what was maybe be a little better.
Okay, then I think you should go and do that. Thank you very much, Team Czech Republic.
Thank you.
Hello again, ladies and gentlemen. So it gives me great pleasure to announce the last but by no means least team in the competition final today, the team from Denmark.
Hello, I'm Patrick. Hi.
Simon.
Patrick.
Hello.
Patrick. Hi. Hello. Hi, team. Who's going to be the team leader?
Me.
And your name is?
Simon.
Simon, I'll quickly tell you the story, and then you can brief your team and allocate roles shortly. If you first want to check on battle materials, if you're not familiar with the DFIP or with the bat, you get 2 minutes to do this.
Thank you. Hvordan står sengen i forhold til scenen? Jo. Så får vi DFIP'en herover, som vi plejer.
Ja.
Og den her, den kommer nemt nok af.
Ja, der. Jeg har det.
Er den ikke i vejen?
Godt.
Ja.
Og jeg skal have en hand
Okay.
for os.
So I'll tell you the story. It's the parents called. You're in the ED. They have a 5-year-old boy, Timmy, who in a period of like 30 minutes became unwell, not reacting, looking pale. They were very anxious, and they just rushed over here because they're so close to the department. I can tell you he's around 20 kilos for your convenience. There's not much more information than that.
Okay, so Timmy, 5 years of age, during the last 30 minutes, he's become pale and unresponsive. The parents are worried.
Yeah.
And they're bringing him in.
They bring him in themselves.
They live close by.
They live close by.
5-10 minutes.
Yeah, so you have 2 minutes to breathe, and then they'll definitely be there.
And 20 kilos.
And 20 kilos.
Okay, godt. Som vi snakker om, 5 år.
Ja.
Vi kører adrenalin 0, 2, 20 kilo. Vi kører amiodaron 100. Vi kører joule 80.
Og ellers runder op.
Ja, ellers runder vi op.
Tubestørrelse 4,5-5.
Tube 4,5 til 5.
Og en 5 er klar.
Og hvad siger du?
4,5 og en 5 er klar.
Ja.
Can you do communication in English?
Sorry.
Thank you very much.
For liquids, it's going to be 400 milliliters if he needs that.
Yeah.
Glucose, it's going to be 2 to 4, so that's 2.
Fluid bolus.
4 to
80.
4 to 80 milliliters of glucose.
Yeah. Hypovolemia.
Yeah, so blood would be, so it would be saline to start with, and then seronegative rescue blood.
Yeah, and early advanced airway management.
We've got the parents probably here as well. Lena, if you do the parents more than you do the airways, you prepare the DFIP if we need it, and you'll do the initial compressions if we need that. I'll assess the child as he comes in. Great.
Ideas?
And he thinks of the course. He's 5-year-old, no history of anything. It could be hypoxia, or hypovolemia. That too, yeah. We don't know anything about it. It could be heart disease.
Yeah, it could be heart disease.
It could be poison. It could be anything.
Yeah.
But we'll start with hypoxia and hypovolemia, and work from there.
Team, are you
Great.
ready?
Any thoughts?
Okay.
Let's do this.
Okay. Then I feel the parents coming.
Okay.
I hear them coming
Morten,
as well.
Could you prepare the bed?
And there they are.
Oh.
Can you help my boy?
Put him on the bed. On the bed. As high up as you can. Thank you.
I'm here.
Okay. Timmy?
What's going on?
Timmy.
No reaction.
No reaction.
Hi.
I'll check for signs of life for no more than 10 seconds.
No chest rising, you don't feel anything, and there's
Okay,
seems to
5
be
rescue
no
breaths.
signs of life.
Okay.
2, 3, 4, 5.
And check for signs of life.
No reaction.
No signs of life. Commence CPR. Unless we need to put on the pads.
I will.
And you tell me when the defect's ready. Right. So we're in cardiac arrest and analysis. As soon as you're ready, you'll do the AO.
I will.
Right.
No. Oh,
Let me know when it's ready.
If you're ready.
Stop for analysis. Commence CPR. We've got a shockable rhythm while charging. Unless you do the AO. Stop. We need the 80 dual. Let's do 100. 100 dual charging. Thank you.
Thank you. Okay, all clear?
Okay.
Stop CPR. No.
Start CPR, first shock delivered. All right. Modern, if you could prepare for intubation as soon as you're ready. Unless you do the AO.
Yeah, it was.
Yeah, this is working.
1.
Okay, you've got it
IO
in.
is in. Easy IO is
Anas,
okay.
prepare some saline to flush in the medicine.
One moment.
And then 0.2 milligrams of adrenaline. If you could prepare that. And 100 amiodarone.
Okay.
So you're doing 15 to 2. And Modern, you're doing the intubation.
Yeah.
So we've got a 5-year-old child with cardiac arrest. He's allergic to eggs and he's been eating. So it might be anaphylaxis actually as the first cause. We are preparing the adrenaline. Anas, if you could prepare 0.15 adrenaline for IM administration as well.
0.15.
Yes, please.
Dysfunctional laryngoscope.
Okay. Right, you'll just continue with the 15-2.
0.15 adrenaline for IM.
Thank you. Let's administer that right away. IM.
Okay.
And we've got the meds ready for IV.
I got adrenaline and cortisone ready for
Thank
the
you.
CPR.
So 10 seconds for analysis.
Yeah, patient's intubated.
Thank you. Could you put on a capnograph? And Anas, if you could take the stethoscope and check for 2 placement.
I will.
Stop for analysis. We've got a possible... Is there a pulse?
There's no signs of life.
There's no pulse. Continue CPR for 2 minutes.
Count 9, 10, please.
Yeah.
I'm listening for chest sounds.
9, 10.
I'm listening for
1.
chest sounds.
Okay.
Yeah, just go.
It's
Continue.
symmetric when you ventilate, there's nothing else.
Okay. Two
Continuous
correct
compression.
placement.
Thank you.
Bilateral breath sounds.
Okay. Feeling unwell. Okay. So let's run through the other reversible causes. Hypovolemia. Has he been bleeding or vomiting? Line, could you ask for vomiting or diarrhea? Nothing like that. So hypovolemia is not very likely. Hypoxia due to the asphyxiation in the anaphylactic shock could be a reason. We've got him intubated and on 100% oxygen.
100% oxygen.
Thank you.
Hypovolemia, do you need to flush 80 milliliters of saline?
No, I don't think so.
Okay.
No.
Right. It's closed for now.
It's closed, thank you, and ready for meds. So we've got hypothermia. He came in from home. Does he feel cold?
I take a temperature.
Doesn't
Let me
feel
take
cold,
a
and I think if you would meet temperature is around 36.
Okay. And could you take an arterial blood gas?
I'll try.
To check
Yes.
for the potassium levels. Right.
I try for arterial blood gas. I try to take a arterial blood gas.
Yeah, you succeed.
I succeed.
Okay.
Okay.
Simon,
Thank you.
I got onconography.
Thank you. And what's the reading on the capnograph? What's the reading?
12.
12. Okay, thank you. So we've got the H's covered. Let's do the T's. We've got 30 seconds till rhythm check. Thrombosis and tamponate's not very likely. He's a 5-year-old boy and no cardiac surgery. No. We've got the tension pneumothorax. Was there breath sounds on both sides? Thank you. And the toxins, nothing, no medicine. Thank you. So it's most likely the anaphylactic shock. 5 seconds. Stop for analysis.
Did we do this?
Is there pulse?
There's no pulse.
There's no pulse. Continue CPR while charging. We've got a pair. No, no charging. Thank you. So we need to give the adrenaline. 0.2 milligrams IV.
8, 9, 10.
And you do continuous compressions and about 10 to 12 ventilations a minute. Thank you.
10.
Flushing with 5
9,
of
10.
saline. Thank you.
9, 10.
Okay. But there might be some crossover between eggs and peanuts in the Snickers.
9, 10.
Yes,
9,
another
10.
0.2 milligrams of adrenaline. Prepare for that.
9, 10. 9, 10.
Thank you.
Can you feel it? 9, 10. Can you feel it? Can you feel it? Is he in pain?
All right. To summarize, 5-year-old boy, probable cause of cardiac arrest, anaphylactic shock. It could be hypoxia as well. We've got both things covered. We've given him adrenaline and we're giving him 100% oxygen.
How much fluids have we
Only flushing.
9, 10.
Yeah. Because the hypovolemia is not very likely. He's not been bleeding, vomiting, or diarrhea, anything like that. It could be a part of that. We should probably give 400 milliliters. You're right. 400 milliliters as a bolus. Yeah. On a 50 milliliter syringe. And if you connect it to the 3-8 port.
9, 10.
Thank you. 5 seconds for analysis.
9, 10.
Stop for analysis. Is there a pulse?
You have the impression that you indeed feel a pulse.
Okay. So we've got return of spontaneous circulations. We'll do the quick look. Is he awake?
He's not awake.
He's not awake. Is he breathing spontaneously?
He's not breathing spontaneously.
No. And how's the color of the body?
It's still a bit pale.
Still a bit pale. Okay, so we'll do the ABCD. We've got him intubated, and the capnograph says...
Capnograph has gone up to 56.
Okay, thank you. So we've got breath sounds on both sides as well.
Chest rising.
Breath sounds.
Yeah,
and chest rising symmetrically.
A little bit of crepitations, but symmetrically.
Okay, thank you. So let's do the B. We need an oxygen saturation and count the respiratory rate. That's actually Morten doing that. So we'll keep him about the 20.
About 20,
and use the capnograph as a guide.
Saturation on, Simon.
Saturation is 94. Saturation is 94.
94, thank you. All right, let's do the B. We need the five P's, the pressure and a pulse, Tabitha, if you could do that. And as if you could check for a preload, the liver, and also check for jugular vein dilation.
It's not much jugular veins, but you have a liver of 2-3 centimeters below the...
Okay, so he might have actually an increased preload. Yeah. So no more fluids for now.
Okay. It's a bit less than centrally, but you feel it.
So that's the pulse volume, and we need the CRT as well, if you could check that, the capillary refill time.
It's 3 seconds.
3 seconds, all right. And how was the... So it's still in line with the anaphylactic shock. D, is he waking up? Is he responsive at all?
No.
No, and not even to pain? Not responsive to pain.
Do you want me to do an IV line?
Yes, please, an IV line for later.
Check for pupils.
Check for pupils, thank you. He's unresponsive on the output scale. And actually, Anas, if you could do the...
Pupils are fixed mid-standing.
Fixed standing pupils.
Thank you. If you could do the blood glucose as well, Anas.
Blood glucose. I actually sent in a natural glass for a while ago.
Yeah.
I don't know if you
comes back, it's a bit acidotic. Well, it's definitely acidotic. It has a glucose of 185 milligrams per deciliter. So that's about 12, I think, in millimolars.
Okay. So he's definitely not hypoglycemic.
Electrolytes are normal.
We'll expose him entirely.
Yeah.
We'll expose the patient entirely, have a look at the body, any rash, any edema.
Nothing special.
Nothing special. And a temperature, Tabitha, if you could do that. Okay. Thank you.
36 it is.
Okay, so we've got return of spontaneous circulation. We've got a patient intubated and unresponsive with an ABCDE that's fairly normal. We need to get him to the pediatric ICU. So I'll have a contact with them, and I'll also call in the pediatricians to make the assessment.
Perfect. They will come and they will take over. Thank you very much.
Thank you.
Thank you.
Well done.
Do stay here for the debrief.
Team Denmark.
Yes.
Sorry, it's not over yet.
Oh.
So, Simon, you were the team leader
Yeah.
for that resuscitation effort. You had a team that seemed to be very, very good in their work. Were you happy with their performance?
As always.
Oh, as always.
Thank
That's
you.
the correct answer. And as a team, did you feel that you gave your best performance today?
Yeah.
You hope so.
Yeah.
So what was the biggest stress in that scenario?
Well, obviously we were one man short. We actually missed a part of our team, but we felt the necessity to take care of the parents in this stressful situation. So that was definitely stressful, but we managed to take care of the assignments that Line would normally cover, and make sure that that everything was covered, even though we were one man short.
Okay, so we obviously had that extra stress with the parents. So how was that? How did that go?
Sorry. I think it went well. It was they gave a lot of information once they came in, and I got the questions right, and I gave the information onto Simon, which was actually useful information we got from them. So it was a good decision.
Oh, absolutely. And I noticed that there was a bit of discussion with your team members that they were helping you with. I think you helped with a decision late in the resuscitation.
Yeah. We talked about the hypovolemia not being the primary cause, but actually Tabitha reminded me that in the anaphylactic shock that we had as a suspected main cause, that the hypovolemia is secondary to the anaphylactic shock. So we gave that one bolus of saline, and then afterwards, when we did the ABCD, the liver was actually a little bit it's distended, yeah.
Yep.
So.
Okay, so maybe your team was one man down, but you were one definite woman up.
Yeah.
Yes. So now, the resuscitation is finished, the child has been taken away. What would you normally be doing right now?
Normally we do a debriefing session. Maybe if they take him to the ICU, I would stay in the room. We could go to maybe the Kapstuen. Yeah, the break room. Anywhere where we could sit in private with all staff members involved in the resuscitation effort. And yeah,
and other people as well that have been
because
involved.
there would probably be ward nurses as well, or maybe we were in the emergency department, some of the staff involved in it, seeing him being carried in by the father. So if anyone had any thoughts about that process, we would take them in and talk the whole thing through.
Okay.
Good things and bad emotions, also on top of the actual medical discussion.
In which case, I think you should go and have that debrief now.
Thank you.
Many congratulations.
Thank you very much. So, ladies and gentlemen, to let you know, then we will announce the winners of the competition at the closing ceremony later today. I'd like you all to join me in thanking all three teams and indeed our judges. Thank you.